Change can be hard. It takes time to change the mindset of others, especially if they've been doing things a certain way for a long time. One reason healthcare facilities are sometimes hesitant to adopt the use of mechanical assistive lifting equipment is due to myths about it. By no means does having mechanical lift equipment eliminate the risk of MSDs 100%, sure, but it's a huge step to decrease the risk. Let's unpackage and then debunk some of those myths. Myth 1. Tell me if you've heard this one. Workers can be properly trained to only use body mechanics and injuries will be avoided. This is just not true. There have been more than 30 years of research indicating that although proper training on body mechanics is helpful, it's not effective in truly reducing the amount of MSDs that occur in the healthcare industry. Instead, a safe patient handling program needs to be in place, which includes the use of mechanical assistive lifting equipment. Here's another myth. Using lift equipment takes more time and isn't as comfortable or as safe for patients compared to manually moving them. Alright, you heard the myth, now for the facts. Patients should be talked to about the lifting equipment prior to its use and told that it's being used for the safety of all involved. Lift equipment helps prevent falls and bruises. Several studies have noted that patients are more comfortable when moved via equipment. As for the amount of time needed, as long as employees are properly trained, most mechanical devices require fewer people and less than 5 minutes to use. It can take longer than that to gather enough personnel to help with a manual move. Okay, third myth. Lift equipment isn't cost-effective or affordable, and workers won't use it. Sounds like a problem to me, right? Well, as mentioned earlier, hospitals alone lose a few $1 billion a year because of worker compensation losses. Truth is, although the cost is high up front, the benefits definitely outweigh it in the long run. Having lift equipment causes fewer injuries, which means less time missed at work. Staff retention and quality of work life in turn are higher. If workers are properly trained, they'll use the equipment as well. One survey by the American Nurses Association stated that over 75% of staff are likely to use lift equipment when it's available. Okay, so we've debunked some of these myths. Now let's discuss how employees can and should be protected in the workplace.